Good afternoon, everyone, and welcome back to the Recovery Science Echo, brought to you by Peer Recovery Innovation Network and the Center for Substance Use Training and Telementoring CSTAT. We are excited to host this Echo, this new platform to provide you a seamless experience for all you learners. My name is Shreya Prasanna, and I will be facilitating our discussion today. A few quick housekeeping notes before we begin. To help us with attendance, please enter your name, email, and affiliation into the chat. To access the chat feature, please click on the speech bubble icon on the navigation bar at the bottom of your window. We encourage everyone to join by video, especially for the discussion portion in the latter half of the session. That said, regardless of how you've shown up here, we're just happy you're here to learn alongside us. We are recording these sessions for later distribution through the Buell, Texas YouTube channel. Any information you put in the chat will not be shared in the recording. Please stay muted unless you're speaking, and we do encourage you to speak. If you join by computer, your mute button is on the bottom left of your Zoom controls. You can also use the emotions menu on the bottom right of your Zoom screen to raise your hand and indicate you have a comment or a question to share. You can also use the chat to share your perspectives. There are a lot of us in the space, so please do keep your comments brief to allow others a chance to speak up. And finally, please note that no protected health information is allowed in either the chat or our discussions. Towards the end of the session, our wonderful IT support, Karen, will send out a link to an evaluation survey. Please fill it out for a few reasons. It gives us your feedback on how to refine and shape these sessions to address your priorities, and it allows you to access free continuing education credits. All participants filling out this survey will be automatically entered into a raffle for a $30 Walmart gift card. Our didactic today will be presented by Eden Buell and is on community-based participatory research. Following that, Nima will be presenting a research project that is in progress. We will start with some introductions, followed by didactics, announcements, case presentation, and an open discussion. Thank you all for joining us today. These sessions are what we make of them. We encourage you all to share your questions and insights in today's conversation. And with that, we will begin with some introductions. Cheryl.
Hi, everybody. Thanks for being here. My name is Cheryl Pacapelli. I am a person in long-term recovery, and I am the project director in New Hampshire, overseeing the contracts for 20 recovery community centers. So happy to have all of you researchers here.
Thank you so much, Cheryl. Emily.
Hi, everybody. Nice to see you all. I'm Emily Hennessy. I'm an associate director at the Recovery Research Institute at Massachusetts General Hospital, and also director of biostatistics there.
Thank you so much, Emily. And we are thrilled to welcome our newest hub member to the Recovery Science Echo, Patrick. Patrick, could you please introduce yourself today?
Yeah, absolutely. I'm an assistant research scientist at Chestnut Health Systems, formerly incarcerated researcher in long-term recovery as well. Super happy to be here.
Thank you so much for joining us. Eden Buell.
Hi, everyone. My name is Eden Buell. I am a JEAP Postbaccalaureate Trainee, or a Justice Involved in Emerging Adult Population Postbaccalaureate Trainee. I'm an individual with direct and indirect lived experience with justice involvement, as well as substance use and substance use disorder. And I'm really excited to be here today. I'm with Chestnut Health Systems as well.
Thank you so much, Eden, for joining us. Kirsten.
Hi, I'm Kirsten. I'm the project coordinator for PRIN, and I'm very excited to hear today's talks.
Thank you so much. Andrea Hepler.
Hello, everyone. My name is Andrea, and I'm one of the program coordinators here at CSTAT, at the Center for Substance Use Training and Telementoring, here at the Buell Institute at UT Health San Antonio. Welcome, everyone.
Thank you so much. And Nima.
Hi, everyone. My name is Nima. I am a second-year medical student at UT Health San Antonio. I'm also a person in long-term recovery myself, and I do peer support on the side.
Thank you so much for joining us today. And with that, we will get started. Karen, if you could please bring up the slides. Thank you so much. And Eden, you can take it away whenever you're ready.
Awesome. Well, thank you all for joining me today, and I'm really excited to be here. I would like to talk about advancing community-based participatory research. This project or this talk is really informed by the Justice Evolved and Emerging Adult Population Initiative. And this is kind of some of the learnings that we have by working with our 3 community boards. So next slide. And this is just a disclosure that all members, all speakers and members of the planning committee have no relevant financial relationship with the commercial interest in disclose, as well as the views and opinions expressed by myself or other participants attending the ECHO session are solely their opinions and do not reflect the official position or policy of UT Health San Antonio. Next slide. All right, so for today, the learning objectives are: what is community-based participatory research? We're going to define some roles and expectations. We're going to try to understand who needs training and why. We're going to try to talk about the practical, administrative, and logistic considerations, as well as recognizing expertise. Next slide. And so an official definition of community-based participatory research is a collaborative research approach that equitably involves all partners in the research process and recognizes the unique strengths that each bring. Next slide. And with that, there are a few guiding principles. These ones are kind of roughly put into my own words, but these guiding principles really help to make sure that we are incorporating CBPR in the right way. And so some of this process when it comes to equitable involvement, we're thinking about community members, right? They should be included in every step of the way. Bidirectional learning is a principle that should be really taken seriously. Being open-minded, especially for researchers, community members, and everyone involved, knowing that they can learn from each other in ways that they probably did not even expect is a really important aspect of CBPR. We want to make sure we're having effective communication, right? Really thinking about when we're thinking about engaging community members, are we translating materials right? Do they understand the materials if we're approaching them and asking them to be a partner in this work? We want to make sure we have meaningful collaboration, right? We just don't want to say we're collaborating and not actually collaborate, right? Really listening with an open mind again, and just really trying to work together to build that partnership is really important. You always want to be transparent, let folks know where you are in the process, and let them know beginning, middle, and end what is going on. We also want to be culturally responsive, right? We want to make sure we're taking into considerations different cultures across all different types of diversities. And then we want to make sure we're having that mutual respect, right? Thinking about researchers, and often there's PhDs attached to the end of the name, but those with lived experience and community members are just as much of an expert as someone who holds a PhD. And so making sure we respect them mutually is really important. We want to empower everybody, especially community members, to feel comfortable being able to speak up and talk in these groups, or being able to really feel empowered enough to know that their input and their guidance is really being taken seriously. We want to make sure we're sharing benefits, right? We want to make sure everybody involved is getting something from this. And we want to make sure we're building that trust by following these guiding principles. And so next slide. All right, awesome. So when we're thinking about roles and trying to define the roles, we have roles for the researcher, the community member, staff, and also guest. And the expectations for these roles are making sure that everyone holds privacy, there's autonomy, equity, and cultural responsiveness, right? And so just kind of thinking about like the role of the researcher, your role in this is to kind of spearhead this project, and not by just thinking about what the project's going to entail and how you can get it done, but also thinking about how you can make it a collaborative effort, and making sure that's something that you do throughout the entire process. Making sure you have that willingness to learn again, listen, and like truly foster those relationships is your responsibility and something that you should take into consideration. Something that's really critical, though, one of the most important parts, is making sure that we avoid tokenizing anyone. So that could be community members, staff, guests, and other researchers. A lot of the folks that we are trying to kind of incorporate in this work have lived experience, come from different diverse backgrounds, and so we want to make sure we're avoiding that tokenization at all costs. And then we want to make sure as a researcher that folks have autonomy when we're engaging with them, right? Making sure that we recognize that their story is their story, and they can share as much or as little as possible, without kind of being a researcher and wanting to dig into more, because that's what we really want to do half the time. But just remembering that folks, when we engage with community members, they have the autonomy to share what they feel comfortable. And so with that, we also have the role of the community member, right? The role of the community member is invaluable, right? They have lived experience, they've been there, and they know what it's like to be in this situation, right? And they bring a lot to the table. But we also want to be mindful that typically when we're working with the community members, we're working with quite a few community members. And so they have a responsibility or a role. Their role is to kind of make sure they're keeping that privacy, making sure they're being culturally responsive as well to other members who might be community partners, working together. And so making sure that they kind of follow that role, and make sure they know, again, that they have autonomy in this, and that when we're kind of working together, we want to make sure that folks can attend or have availability to do this work, because it's extremely important. And then we have the role of the staff member, which is critical, right? They play a big role in handling sensitive information, facilitating meetings, setting up meetings, making sure things run smoothly, right? And so we want to make sure that we're thinking about how they can really kind of effectively effectively land that information, like be able to kind of keep that sensitive information and run the project smoothly. And we encourage folks to also consider taking or hiring staff members with lived experience, because they're going to understand in a better way the consequences or the unexpected, unique situations that might pop up for folks who have lived experience, and so they'll do a really good job at making sure they're keeping things confidential and making sure things are running, because they're usually really passionate about this work. And so the role of the guest is also to make sure they're completely trained and ready to engage with community members. They're trained in CBPR, but engaging community members with that open-mindedness and willingness to learn. So the next slide. So much. And so who needs training? Everybody needs training. So when it comes to the researcher, make sure they're equipped with the skills to be culturally responsive, and ethically engage with community members, and understand the respect and the community context, where they come from, fostering partnerships. Those are all things that may seem innate to folks, but may need to be trained on and may need to be able to kind of learn new things that they didn't think about before. And so making sure we have everyone on the team really be trained in CBPR is critical. And so same thing goes for staff members. We want to make sure they're also trained again in that making sure privacy concerns are really kept great. We want to make sure that they manage logistical processes smoothly. And they also support folks typically in kind of vetting materials, making sure they help researchers be able to translate their work into lay language for folks who may not be in the research realm. And that's part of that training process as well. Again, we want to make sure we're training anybody. So that's why I put it as guests, but anybody that comes to the boards, they should be trained in CBPR practices and be able to engage ethically with the community members. And finally, we want to make sure we're training our community members, right? They can't come to the conversation prepared to kind of really be involved and really be embedded in the work if they don't understand research themselves. And so making sure that folks know about the research processes. We know they're community members. We're not going to dive in a full deep dive into how to do research, but making sure they can be able to come to these meetings or groups with the sense of what we're talking about is critical. And so making sure they're trained in that is also really important. And we also want to train them in CBPR, right? We want to make sure that they know, like, hey, am I really embedded in this work? Am I someone who's really participating? And are folks taking my thought processes seriously? And so making sure they're trained is really, really critical. So next slide. Oh, the logistics. Phew, phew. This one's intense. Logistical processes are extremely, extremely important to make sure that we're engaging our community members properly and properly implementing CBPR. And so when we're thinking about logistics, we want to think about recruitment, right? We want to be mindful of cultural considerations, again, that tokenization process, making sure we're not doing that, ensuring that we're being inclusive and respectful to our community members. And so when we're kind of recruiting for folks, you want to look at it more as, you know, we need each other. We need this partnership. And so thinking about recruitment not as like a job interview, but more as a learning experience is really important. We want to think about facilitation, right? Typically that's done by staff. And what I mean by facilitation is like if you have a virtual board like ours, we want to make sure that we have someone guiding the Zoom, guiding other processes, making sure things run smoothly. But we also want to think about facilitation in terms of giving that autonomy to the community members, right? So something we do in our boards is allow community members to also be co-facilitators and participate in the work, present things to the community members, and making sure that they have that autonomy in themselves. Then we want to be flexible, right? We want to think about not everybody can meet during regular business hours, right? Typically, all of us are employed, you know, and the idea is that community members might not be able to be reached 9 to 5. And so really taking to that mindful consideration of when can we meet? If we're meeting across 3 time zones, it might have to be at 8 o'clock at night, 7 o'clock at night. And so when we're thinking about logistics, can you do that? Also, you should do that. And so really taking that into consideration is really important. And there's a lot of preparation that comes with the logistical process, right? We want to plan before meetings, during meetings, after meetings. We want to make sure we're connecting with folks, making sure that we are kind of being really, really mindful of making sure our community members or community members are actually prepared to attend and be able to be ready to kind of engage in the conversation. So we want to make sure that materials are accessible, right? One of the things we do is we have an amazing logistical JEAP team member who kind of does audio recordings. And then we have someone who makes sure they're kind of, you know, chasing folks down and make sure we're scheduling. Scheduling is the hardest part, I will say. You know, considering can we do infographics or how we can make sure that we're presenting this work to our community members is critical. And so there are a lot more logistical items, and I'm going to shamelessly plug that hopefully soon the JEAP initiative will be launching their own community-based participatory research toolkit that you can go ahead and check out. And I know that logistical process is going to be something that if you're really making sure you're doing this, you want to check out. And so next slide. And so for me, this is one of the most important parts of, having that community-based participatory research process done correctly, right? And it's recognizing expertise. And one of Albert Einstein said, the only source of knowledge is experience, right? And so we know that lived experience is invaluable expertise that deserves recognition. By embracing equitable practices, sincere acknowledgement, thoughtful considerations, and genuine partnerships, we can strengthen research and the outcomes within the communities we aim to serve. And I put that there because that's how I feel genuinely. I really feel that those with lived experience are experts. We've been in all kinds of different situations, and although everybody's recovery journey is different, or substance use is different, or experiences are different, we all share a common theme of we've been there. And so it's really should be looked as such. And so when we're thinking about recognizing expertise, we want to make sure we're acknowledging that and acknowledging them as experts. We want to make sure we're taking into consideration, their considerations, right? Being thoughtful and respectful, making sure how can these community members be impacted by being put on a website, or not having the autonomy to be anonymous. And so that is something that we want to make sure that we're kind of taking into consideration, making sure that partnership is real, right? So partnerships, you build are genuine, you're being transparent. Again, those mutual benefits, making sure I guess I keep saying this, willingness to learn, and is extremely important. We also want to make sure that we are compensating equitably, right? So when experts come to kind of speak or kind of be invited at times, folks are offered honorariums or compensation for their time, and lived experience members should be also compensated equitably, right? Just as you would another expert. But we realize as researchers, especially for those early career researchers, that grants can be really small and it might be really hard to kind of figure out how you can compensate with a very small budget of $10,000. And so the idea is we want to think about what other ways we can compensate or allow folks to be honored equitably, right? And so again, compensation is the gold standard, but if you had to kind of think about some other ways to kind of connect with your community members, providing public acknowledgements, right? Consider them consider them as authors in your papers, or credits in a publication, or even credits, giving your community members credits in presentations like this is really important. Recognizing folks. I know I've been a lived experience member in other spaces, and I got a thank you card in the mail and it almost made me cry. So being able to recognize your members that way, maybe certificates for participation. I know for one of our panels, we kind of had a poster board that they were authors on, and we went and made these really cool copies. And I can't tell you, just that little bit of, hey, we've got these copies of this poster that you're a part of, this poster presentation, what a difference it made for folks. And so things like that can be invaluable. Also, try to find and provide engagements and opportunities, and think about how you can lift community members, by recognizing their interest, or kind of like, huh, this is interesting. Maybe I should pass this along to my community board members. Or, oh, there's this conference coming up and they have a travel award. Maybe your community board members or your community members are interested in that. And so you might want to send that information there that way. You definitely always want to recognize the expertise by, making sure you're sharing outcomes with folks, coming back to folks, and making sure you're kind of doing some of what we refer to as member checking, making sure that you're getting the materials right, making sure that what folks said and what you're going to be putting into your work is what they really wanted, right? When you're working with an expert, that's something you would think about, like, before I go out there and put this expert's, all this information out there that they provided, you'd probably want to do like a double take and say, hey, is this right? You want to make sure you're doing that with your community members as well. And you want to make sure you're, again, building up or sharing opportunities that allow them to kind of train in different ways or get skills as in ways that they might like. All of this is really, really important to making sure that we're doing CBPR correctly, and making sure we're implementing it, and making sure community members are really embedded throughout the entire process. And so, next slide. With that, I'd like to kind of give the reference for the definition that I used, and also next slide. I definitely have to give my acknowledgments. And so I want to thank the Justice Involved in Emerging Adult Population Initiative Community Boards, all three of them. They are awesome. I need to shout out Ashley J. Sheeto, who is my mentor, and I'm very grateful for her. I also want to shout out Tess Drzowski, because she's also another mentor of mine, and Sierra Castedo de Martel, who has been like sort of an unofficial mentor, has been amazing. And finally, I want to thank the entire JEAP initiative team who work tirelessly to make sure that we are implementing CBPR, connecting with our community, and making sure we're representing them in a way, and including them in a way that is effective and really important. And so with that, I think I have been able to do that. So yeah, there we go. Thank you all.
Thank you so much, Eden. This was a wonderful presentation. We have a bit of time for some questions from our learning community. So I'm going to open up the floor for any questions or comments.
Go. Hi, I'm Lindsay Kosen. And I'll say that I think one of the really important things that gets very often overlooked is bringing on people with lived experiences and having their experience be their credentials, right? So hiring them in places like universities and places like that, right, without a degree, but with that experience, and paying them the same as you would if they had that degree, right? So if somebody has spent 10 years in their field, bring them on as if they had 10 years worth of schooling, right? And pay them that if you're able to, because that is paying them for that lived experience is so valuable. It's so vital. Another thing I'll say is that not only having people with lived experience help, answer surveys, but having them write your surveys. Those people that have that real living experience, they know what questions to ask. And we're very often get frustrated, right? Because the questions that are sometimes asked by these surveys are just, they're so broad and vague, and they don't necessarily apply directly to things. They're questions that you can have somebody with that living experience will take and tweak that question to really get at the heart of it. And I think that's so important.
Yeah, thank you so much, Lindsay, for sharing that. And I want to say one of the things that we do here with JEAP is while we, like a lot of our team members have lived experience, including myself, we also do that vetting process. We do help with writing, but we rely heavily on our community members. And the idea is that even though we have lived experience and we are somebody that holds some expertise, we want to be mindful that our community members that we've asked to come to the table are really at the forefront of the work that we do. And so we are very conscious about implementing any things like kind of skewing any of the information that the folks want to give by leading them on and saying like, oh, this is what we think. We kind of take ourselves and remove ourselves from that situation and allow them to kind of take charge. So yeah, thank you so much, because some of our community board members have kind of really been able to do that, and we're really lucky for that. So thank you for bringing up those awesome points.
And you'll notice the difference between community board and community advisory board. Community advisory board is sort of the traditional way that these types of bodies are described. And through JEAP, Ashley and other folks are like, they're not advisory, they're part of the research team. So this is our community board, right? In forming a research project and a research team, they are vital members, so they're not advisory.
Thank you so much. Yeah.
Yeah, I wanted to say thank you so much too for that presentation. And as a peer, you know, I so value that people want to hear our voices, and it just gives me so much hope that many of you are also in personal recovery, which helps it. But like for me, I'm in recovery for 35 years. So I'm not there anymore where I can give that like valuable feedback about what's happening in my neighborhood, in my street. So making sure that there are other voices at the table that are close to the work, that are doing the work, is like just absolutely invaluable. And it so helps with stigma to other people in the community that like, oh my God, like I always look down on you, but you're my neighbor. And like you've been doing all this work at the food bank. I had no idea you were in recovery, right? And that has a ripple effect in a community. So I so appreciate like thinking about this. And also someone talked about the wording, right? My staff will even look at my stuff and say, you're not using the right language. Like, you know, I've been an addict for 35 years. It's hard to not say that all, like, you know, and I'll slip in, you know, clean every once in a while. And so whenever we do surveys, we make sure that somebody else looks at them for language. You know, sometimes somebody slips in homelessness or, you know, chronic abuse instead of substance use. So I really appreciate your thoughtfulness in all of that. And I think over time, it will help our research be a lot better and inform what we're doing in the future as your generation moves us along. So thank you.
Thank you so much, Cheryl. And thank you again, Eden, for this wonderful presentation. And thank you all for chiming in for your awesome comments. So please keep the conversation going. And I'm sure Eden can answer if you had any questions for her. In the meanwhile, we will move on to the next part of our session. Karen, if you could please bring up the announcements. Thank you. The Center for Substance Use Training and Telementoring, CSTAT, offers technical assistance for various substance use disorder needs and topics. We are a team of experts. To request technical assistance, please complete an online request form and we'll be pleased to help you. And we can drop this link in the chat. Next slide, please. The Recovery Science Echo offers CEUs accredited and approved by the National Association of Addiction Professionals. To claim your continuing education credit, you must complete the post-session survey using the link in the chat or by the email sent after this session. Next slide. The 2025 Texas Substance Use Symposium is officially open for registration. Register today at texas.org to join us in person or virtually on February 27th and 28th, 2025 at Hotel Paso del Norte in El Paso. Next slide. We are now accepting sponsor and exhibitor applications for the Texas Symposium. 100% of your support will go towards providing a free continuing education symposium for all attendees, funding travel grants for experts in the field, and underwriting other event-related costs. To learn more, please visit the link in the chat. And finally, join us for our next Recovery Science Echo on Wednesday, February 19th at 12 p.m. CT. And with that, we will move on to our case for today. Karen, if you could please bring up the case, and Nima, you can take it away whenever you're ready.
And actually, if you want, I can just share my screen. I have the form.
Okay, awesome.
So like I said, my name is Nima. I'm a medical student. I'm also a person in long-term recovery. And so my background actually is in peer support. It's what I did before medical school. And I used to work in Georgia where they had a very robust peer support program in the ED. And so I'm really interested in bringing it to our emergency department here at University Health. I actually shadowed a emergency physician preceptor, and I would do peer support during my shadowing sessions. And I found that people were so much more interested in taking resources when it was a peer talking to them about recovery. And I became super interested in trying to spread this so that I'm just not some random med student doing it. I have a lot of contacts in Georgia that I think could be helpful to this effort. And obviously there's tons of good data out there to suggest that it increases follow-up and it reduces hospitalizations. And the general format for people who maybe aren't as familiar is basically when people are admitted to the ED for some sort of addiction-related physical illness, before they leave, a peer comes in and talks to them about recovery, kind of does the whole motivational interviewing thing, plus like some of the sharing the lived experience, and helps connect them to resources. And then typically afterwards, we'll also call them, kind of follow up on them, see if they connected, see if there's maybe new things that they need, and kind of just make sure they stay like socially integrated. The reason why I was really curious about this is just because I am just a medical student. I don't know anything about applying to grants. I don't know how to, approach hospital administration. I also don't really know good ways to track outcomes. I have some ideas, but I'm definitely not an expert in this. And I have a lot of research experience, but I've never done anything like this, like human, peer support. I'm more of like a bench work, like pharmacology kind of guy myself. So really, I'm trying to understand like, what kinds of grants do I apply to? How do I approach the administration even? It might even be the case that they might just be willing to hire somebody because they believe that it will reduce their costs. How to like kind of what I can expect time-wise to spend on an effort like this, whether or not I should just like give this as an idea to someone else and be like, my name doesn't need to be on this. I just want to see this happen more than anything. And then how to ensure like sustainability long-term with a program like this.
Thank you so much, Nima. I'll open up the floor for any questions or comments from our learning community here.
I have a few comments. Hi,
Yeah, go ahead.
I'm Dean Bolton. I'm actually at the Buell Institute now, but I worked at University Health for a long time in different capacities. So I'm very familiar with the organization. I would say that it's really tough to push those initiatives, especially when you're arguing for hiring, but I would start with your preceptor in the ED, which would eventually hopefully lead up to a connection with the vice president over the ED. Like that would be your pathway to get the idea rolling. If you gather support within that line or chain of command, I think you have a good chance at finding out what you need to do, whether it's a grant application or whether it's something that the university or the hospital itself is willing to fund. But they definitely want to know return on investment. and
Yeah.
what we can expect for readmissions and the impact. So those are just some things that I know they'll definitely ask.
Thank
you.
you.
I really appreciate that.
Lindsay, had a comment?
Yeah, so somebody does already put, I know that we have peers in a couple of the emergency departments. I believe it's with UT the Dell Med Center. So it might be helpful to reach out to them.
That's great to know, because I was thinking about reaching out. I went to Emory for undergrad, and they have a really great program there, but having somebody a little bit closer and that operates in Texas is probably super helpful.
You know what? It might be through Communities for Recovery. They had somebody who was liaising with Dell, the Dell Med Center.
Thank you. Alyssa?
Yeah, hi. So I work with Cheryl Pacapelli in New Hampshire, and several of our recovery centers across the state have different collaborations with hospital networks and ED programs, like you're mentioning. And a couple of things that we've learned in New Hampshire is that I would kind of strongly encourage you to consider community partnerships over having hospital hire peer workers to as like employees. So a couple of issues we ran into that was the hospital had to overcome several internal barriers if they're hiring peers, specifically regarding criminal background checks and their existing policies with those. So that was one huge barrier that they ran into. But the other things are more around sustainability. One, like if you can develop a partnership with a local recovery community center, one, it offers sustainability for the community center, which is always great. But it is often we're having issues in New Hampshire with hospitals that have specifically hired peers, that they don't have the infrastructure to maintain the workforce, right? So peers have very different CEU supervision requirements, things like that, and the hospitals also often don't have that capacity to provide supervision or continuing education opportunities for peer support workers as employees, so they are forced to look externally. Whereas if you had a community partnership with an existing RCO, they already have those built in, obviously, because peers are their primary employees. So just things we've learned here.
That's a really great point. I think the one, I guess, question I have is, because at least in Georgia, when you want to do peer support in the ED, you get hired and then you have to go do a 2-week training. So it's like not just any regular peer can do it. Like you have to get trained in it specifically. Do orgs like here, like how would that look in terms of like, would they train, like just if you had to guess, like would they train certain peers, maybe take them to a place that does it and then bring them back and they're just responsible for the hospital? And then also in those systems, are they able to put in notes into the electronic medical records?
I don't know about the medical records, but I would say on trainings on both parts, right? I think in specific the ones that have collaborations, the peers go through trainings on the hospital end, but it's also very important for the hospital staff to get training regarding the peers role and on the peer end. So mutual training is needed on both sides. I can't speak to the electronic health record though.
I can speak to the electronic health record as a former builder of Epic. That's going to be a challenge for an individual that's not directly employed with the hospital because they don't have a security permission class to give them access. So that will be a challenge. They'll have to come up with some kind of workaround if there is one, or some kind of other approach.
Okay.
Thank you. Eden?
Yeah, I just wanted to mention that one of the programs that I kind of volunteered for when I was in my undergraduate studies was a program called Detroit Life is Valuable Every Day, and I'll put that in the chat. And that, as someone in this space, I've also been a victim of violence, and it's a violence prevention program, but it's a program that would kind of in Detroit, there's a lot of gunshots, wound victims that would come in, and then there was a lot of retaliation, and then they would come back DOA. And so they kind of implemented this program to try to prevent violence or retaliation. And they used peers as well. And so a lot of the gunshot wound victims, they would send a peer who's kind of even been incarcerated 20 plus years to the bedside of the gunshot wound victim and kind of help. And so I was wondering if maybe you might want to take a look at, or just wanted to pop that in there, maybe take a look at that model and see how they kind of approach some of the barriers that you are facing right now. And I also wanted to just quickly add that checking in on folks is amazing. So I appreciate you for doing that. I know with our community board members or our panel members, we don't hear from folks. We don't just move on. We kind of check in on them, make sure they're doing all right. But yeah, hopefully that's a resource that'll help. I'm trying to find more information for you.
Yeah, and Nima, this is Cheryl. Alyssa just spoke a moment ago. We worked together, and we would be happy to connect you with some of the executive directors who have successfully got into do ED work to talk to you about what they did. But one thing Alyssa didn't mention that they all say in the beginning, they needed a champion at the hospital. You'll be able to find champions in the Recovery Community Center year one, right? Who is now going to be a doctor. Like that will hold a lot of credibility as you try to bring this forward. But having a cheerleader at the hospital that wants to do this is critical. And then, working with your local recovery community center, if you did peer work, I'm sure you have those connections and see who wants to do it. Then they're the nonprofit. They can apply for a little grant from a bank to give somebody some stipends to do it or pay for the phone or things like that. And then, collect data, even if it's not in the hospital EHR, collected in the recovery centers EHR. Like we have an EHR that anybody who runs a hospital ED program can get all their data about what they've been doing, how many people they saw, did they come into the recovery center after, follow up with them. We do like telephone support with them. Even if they never come into a recovery center, we follow up with them. So we'd be happy to set up some calls as you move through this process to help you get over some hurdles if you think that would help.
That would be super helpful. And I really appreciate yeah.
And another piece for champions, I think any champion within the hospital is always going to help you. But a lot is, and speaking in terms of pushing this forward into implementation and the barriers that need to be overcome, someone on admin in the hospital. It's a lot of administrative hurdles and barriers that the hospital is going to run into specifically. So I mean, any champion in the hospital will help, but if your psychiatrist person has any admin pull, would be even better.
Yeah, and when you said that, Alyssa, I remembered one of our centers, when they first started going in, they really had to get to know all the nurses. So the nurses understood what they were there for and didn't call them when someone was intoxicated. They waited until they had got them a little stable. But in the beginning, they were calling them at 2 a.m, and we were being dispatched and going, and they couldn't even hold a conversation. So just kind of thinking the program through. But now the nurses love it when they see someone from navigating walking in. So educating the ER team or the emergency department team is extremely important too, to what that role is going to be and what the expectation of that conversation is. But it definitely there's data to support its effectiveness, and that people calm down when they're talking to a peer, and, you know, are more receptive to, you know, try this. And, you know, we have different committees up here, lived experience committees, where we meet with hospital ED staff and tell them about the obnoxious treatment we get at times. And sometimes they're appalled, and all of a sudden they start a new initiative. Like, we can't have this. So, you know, keep doing what you're doing, but be patient. It's not going to happen right away, but don't give up.
Yeah, and it's funny you say that. The last time I shadowed my preceptor, there was a patient. He asked her, you know, the only thing he did, he's like, "Are you interested in resources to like help you stop drinking?" And she said no. And I don't blame him. He's actually a very nice, very sweet guy. Like, there's no stigma that I could see in that interaction. But just the second, I literally went in afterwards for like 3 minutes, and I sat there and I just was like, "I'm personal long-term recovery. You know, here's what works for me," and talking about this idea of, you know, going it alone versus finding connection. And just within a few minutes, she was like taking a phone number for a psychiatrist and for a therapist and all this. It was like, and it's crazy. Just a few words of "I'm a person in long-term recovery" like really changes things just because of how stigmatized the disease is.
Exactly. So, yeah, great. Keep doing it
Thank you.
on your own. And then, you know, somebody will come forward and say, "We should do a program like this." And you'll say, "I've been trying to do that for 10 years. So, or you'll be the head of the ED and everybody will be coming to you. So thanks for your work.
Psychiatry, unfortunately, but maybe I'll be the psychiatrist at the ED.
Exactly. We'll find you.
Thank you. Kristen.
I would love to connect with you about this later, but Houston has the Frontlines program, and so that is a partnership with the Houston Recovery Center, the Houston Health Department, and Harris County Public Health. And so they collect data on exactly what you're looking for, patients that are still at the ER, instead of waiting a day or two later to go out and talk to them while they're in the bed. My background is actually hospital pharmacy before I started on my own personal and professional journey in the recovery world. And one of the difficulties was always trying to get administration to understand the benefit for the patient and the facility, and when all they're seeing is the dollar time, right? And when we have really high periods of infection, like COVID, like cold and flu, or think about how much having a heart attack is going to pay the hospital, you know, personally or via insurance, versus how long is it going to take somebody to get to the point where they are coherent enough to talk to peer support? When does peer support get called? How long does it take to them to get there? How long does an assessment take? And then if there's a discharge plan, how long does that take? All of that eats into reimbursements from COVID, from flu, from ACS. So that was always the uphill battle of, well, I see this immediate dollar sign today if I discharge this patient, right? Because we've revived them and now they're okay. And now we can put somebody else in that bed, versus, hey, if you connect this person with peer support, with outside services, they may never come be in this bed again. It's hard to have that conversation with leadership, with people that, you know, with C-suite. They're there to run the facility, not any individual. That would be my biggest hurdle, and I would suggest reaching out to Frontlines in Houston, because they've been working behind the scenes through not only admin, but also through the health departments to share that data. It does take a village to paint the picture, because if you're only talking to admin and they're only looking at dollar signs, it's a really uphill battle.
And I think one thing that we have going for us is that University Health is like the hospital that all the everyone, especially like uninsured people, go to, the ED at least. And so we're doing this project on doing like street medicine type stuff, and like everybody knows UH. And so my guess would be that of those people who are like recurrent utilizers, the vast majority are probably going to UH. And so they probably stand financially to benefit the most.
Thank you. Emily?
Yeah, I really enjoyed the discussion. I just wanted to pop in with a comment, Nima, about like the funding side of thing, because your case report form mentioned that piece of it. And just some reflections I've had from viewing grants, typically to get larger grant funding for this type of project, from what I've seen is you have several folks, like one who's really embedded in the system, like you might be, and then partnering with someone who could do more of the research scientist approach, but also establishing all those connections that people have been talking about today. You would want to have those letters of support as part of that grant application. So that's something that would, it's probably a few years down the line, thinking like a bigger picture grant to fund this work. I just wanted to kind of lay that out there, but happy to follow up another time about that too.
That's good to know. Yeah, thank you.
Adam?